Okay. Hi, everybody. My name is Dr. Mark Surrey. I'm here with my nursing supervisor, Suzanne Bangis, who is also the specialist for our third-party manager in regard to gestational surrogates. And it would be interesting, I think, for everybody to learn a little bit about this process. So we're going to spend a few minutes together today discussing it. And at the end of our discussion, Suzanne and I are very happy to spend some time answering any questions that you may have. So first of all, Suzanne is got a lot of experience in what's called third-party gestations, which includes ovum donation and gestational surrogacy. For those of you who don't know, gestational surrogacy is a place, that's the surrogate, for your pregnancy to grow and to grow. The egg comes from the intended parent, and the sperm comes from the intended parent, and the embryo then is from the intended parent. The surrogate is a place for the pregnancy to grow. And there are many people who, for different reasons, may have difficulties in carrying a pregnancy. It's clear some people have had, for example, a hysterectomy and do not have a uterus. Other people have either diseases or problems with the uterus, or perhaps medical difficulties that might contraindicate pregnancy, such as renal failure, cardiac failure, a lot of different issues that contradict the state of pregnancy as being in their best interest, and therefore are advised to consider a surrogate. There are also people who simply do not want to carry a pregnancy for different reasons. So the idea of gestational surrogacy is something that I think is good to know about. The idea includes the issue of embryo creation, which has nothing to do with the surrogate, has to do with the laboratory, which here is one of the finest in the world, and is something that offers extended embryo development and culturing, as well as genetic testing of embryos before implantation. So as the intended parent, you know the status of your embryo, you know its structural development, you know its genetic diagnoses, and you know pretty much everything that is of relevance to know about your embryo. The embryos are incubated, therefore grown in one of our laboratories, of which there are two primary labs, one in Beverly Hills and the other in Santa Barbara. We have additional offices in Pasadena and Ventura for your convenience in terms of monitoring ovulation. So the point of IVF is to learn about the viability of your gametes, eggs, and sperm, and what kind of embryos are created. The embryo that develops normally to what's called the blastocyst stage, which is over 100 cells, that normally takes 5 to 6 days to grow, can then be tested. And its testing is done on embryos that can cause a normal pregnancy. We have what's called a time-lapse morphokinetic evaluation of your embryos, which is something called an embryo scope. This is something you can see here. That's a development of 2, 4, 8, 16, 32, 64, 128 cells that take place over 5 to 6 days. And this is all recorded and documented by a video analysis underneath the incubation system. So the technology that is involved with this is relatively sophisticated and very accurate, and you can see normal and abnormal cell divisions that occur over the course of 24 hours for approximately 6 days, which is very different than the average laboratory where there's an incubator and the technicians take a petri dish out of the incubator every 2 or 3 days to see what it looks like. So this is something that we feel is firstly state-of-the-art technology that allows us to accurately assess the normalcy of your embryos structurally. And secondly, what's of interest is that we find that more embryos develop well using this closed system than the traditional idea of taking your embryos and manipulating them externally on a daily basis. So this technology is really important and very valid in regard to giving you the best chance of having the best embryos. These embryos, when they are normally developed, can then be genetically tested. And the genetic testing is performed on cells that are called trophectoderm outside of the embryo. So the embryo is not in any way damaged by performing genetic analysis on it. So these are really important differentiating characteristics of a laboratory that you should be clear about before you use the laboratory. So now we get to the point of having some nice normal embryos, and Suzanne is going to tell us a little bit about what she's going to be able to provide for you in regard to a place for the embryos to go, because the surrogates that she screens and that she approves have undergone fairly rigorous testing to be sure that they're the right surrogate for you. So I'm going to let Suzanne tell you a little bit about the process.
Thank you, Dr. Surrey. So in regards to finding a surrogate, it's normal for individuals to experience emotions of grief over infertility and loss of ability to conceive on their own. So that's when they come in to see one of our doctors at SCRC, especially Dr. Surrey, will then guide you having to create those embryos and then having you choose a surrogate moving forward to go ahead and carry that pregnancy. So the process of choosing a surrogate can feel overwhelming, but we're here to guide you from beginning till the end, help you choose the right surrogate, and in looking for a surrogate, guide you to picking the right one. You're not alone. We're here with you every step of the way, providing you with the resources you need on this journey to parenthood. In regards to the timeline from the beginning all the way to the end of having that baby in your hands can take up to 18 to 24 months. We start off with locating a surrogate. Our team, third-party team, will ask you questions in regards to what you're looking for in the specific surrogate that you are trying to go ahead and go through this journey with. We send you profiles to review. I review them. Medical records are sent over to us so that Dr. Surrey can review. Once you are good to go and you say we would like to go ahead and move forward with that one particular surrogate, we do a match meeting. The match meeting is with the surrogate, the agency, myself, or somebody on my third-party team. Once it's a go, you're able to ask questions in regards to, getting to know the surrogate, knowing that she's available, ready to go, any things that you guys can work on throughout the pregnancy. That usually takes about, depending on how quickly you find your surrogate. Once you're ready to go, I introduce you to the agency to go ahead and sign agency agreements, get that going. We receive the match sheets, and that usually takes about 3 to 6 weeks. We will coordinate with your surrogate when she starts her period. Once she starts her period, we'll go ahead and schedule her medical screening appointment. Medical screening appointment is same day, in and out. They'll do blood work, ultrasound, and meet with the doctor. Once we have the results for that, usually takes about 2 to 3 weeks. We issue legal medical clearance. Medical clearance then goes into legal clearance, and that usually takes about 3 to 4 weeks. Legal clearance is between the surrogate and the intended parents to agree upon what, once the surrogate is pregnant, they agree upon what happens after pregnancy, during pregnancy, and after she delivers. Once we have legal clearance, third-party team will create a calendar of when she'll start her medications up until she'll have her transfer, usually about 18 to 21 days. The day before the transfer, she'll come in for a baseline, for a screening, just to make sure her lining is good, no fluid, and then the embryo transfer takes place the next day. We usually have the surrogate come in or stay on bed rest for 48 hours after the transfer. 9 to 10 days after, she'll have a confirmation of pregnancy test by blood. Once we have confirmation of pregnancy, she'll come in between 6 and 7 weeks for confirmation of heartbeat. And then after 10 to 12 weeks, she'll have 3 OB ultrasounds before she graduates to her OB. So in regards to locating a surrogate, we have you fill out a questionnaire, and then we actually reach out to the agencies, or you yourselves can actually reach out to the agencies, a list of agencies that we offer to you, so that you could find your surrogate. Most of the agencies we do work with send us medical records so that we review with the doctor, and make sure that they are ready to go for pregnancy. So developing your criteria, some of the things you do want to think about in regards to finding your perfect surrogate is location. Location is because, sometimes California has better laws for surrogacy, but you can choose outside of California, which is a surrogate-friendly state. Lifestyle and background, COVID vaccinated, making sure that each surrogate that you're looking to go through this journey with is okay with termination. Selective reduction, CVS or amnio. Amnio and CVS's.
Sure. What Suzanne just mentioned is a CVS is called chorionic villi sample, or amniocentesis, that has to do with a genetic evaluation of different parts of the fluid around the pregnancy. And it's recommended by some people if there's some suspicion of some risk that is above and beyond what we as physicians feel is acceptable for you. And we need to be clear that your surrogate is okay with having a process like this done if it's advised to do that for your betterment, for your well-being, for well-being of a pregnancy. So in terms of the idea of a surrogate-friendly state, there are some states in the East Coast, for example, where when a surrogate delivers, the intended parent then still has to adopt the baby. In California, that's not the case. And so a lot of people from other states actually come here when they're using surrogates. So the timeline that Suzanne gave you was a very conservative one. And it's very common that she and her colleagues can have that go a little more quickly. But she does need to be careful in screening the surrogate medically, legally, genetically, psychologically. And, once we do that, we're fairly confident in the well-being of the surrogate. But as intended parents, we're the ones that really have to be confident. And there are some intended parents who leave it up to us and want to go pick up their baby when they're delivered, and that's the end of that. And that's a little quicker. There are other intended parents who want to get to know the surrogate, want to know where they eat dinner, want to know lots of things about them. And it's okay. You have to be comfortable with whatever it is that works for you. But what Suzanne was mentioning is that some of that's going to impact the timeline as to how long things take to get on track for you. So everybody's a little different, and it doesn't matter what you want because it's your pregnancy. So you should have whatever you want. Suzanne, you want to?
So matching with the surrogate, once you find your surrogate, your agency will send over the medical records, psychological screening for Dr. Surrey to review. Once we have that and we receive the match sheets, our financial team will contact you to go ahead and move forward with the next costs, the costs associated with your cycle. We'll receive the match sheets, and then we'll go ahead and schedule the medical screening for your surrogate. Your surrogate will be in contact with our team to go ahead and let us know when her next cycle will be. Medical screening. Your surrogate will actually meet with a doctor, do some blood work, urine analysis, cultures, pap smear, and HSS. And she'll also be signing some consents. Once that is done, that's an in and out same day appointment. If your surrogate does need to travel here, we usually have them come in for morning appointments and then have them leave the same day.
By the way, there's a little typo there. It's not a hysterosalpingogram, it's a hysterosonogram. So that's an image of the inside of the surrogate's uterus to make sure it's clear.
So the medical clearance, we'll actually issue medical clearance about 2 to 3 weeks after we receive all results. Once your surrogate is medically cleared, you'll be instructed to start your legal contracts. Your legal contracts usually is between you, the intended parents, and the surrogate to agree upon what's going to happen once your surrogate is pregnant up until after the pregnancy. The legal clearance usually takes about 3 to 4 weeks, depending on how quickly you guys go through. The intended parents and the surrogate go through the red lines in the legal contracts. Once you guys agree and we receive legal clearance letter, our third-party team will set up a calendar to start the surrogate for her medical, to start her medications, and then have a transfer.
So thank you, Suzanne. That was a nice summary of what's involved with obtaining and screening a surrogate. Now, it may be that as individuals, you guys have found your own surrogate, and that's okay. But whomever it is, whether it's your cousin or somebody close to you, they have to go through the same physical, legal, psychological, and genetic screening than anybody would have to do. And this is all for your protection. So we take this very seriously and feel that it's really important for you as parents to have all the protection that you're comfortable with for your surrogate. So the idea for the surrogate is that, again, we've got to have a normal embryo. So when you prepare to stimulate the ovaries, some of it is done with natural releasing factors that do not come in the form of pills. They are given underneath your skin. They're called gonadotropins. They normally come from your pituitary gland, send signals to the ovaries to let's ovulate. Next. Because you want to have more eggs than you need. The embryo transfer is something that will be done only after the surrogate has been entirely screened and ready for the transfer. When your pregnancy is confirmed, the surrogate will have on average about 3 visits with ultrasounds and hormone levels before being referred to an obstetrician for the delivery. So it's really very rewarding for all of us to see a graduation, which is when the surrogate goes from here to their obstetricians. And we know that there are usually good outcomes because surrogates should be ideal candidates for your pregnancy. Your embryo is going to be an ideal embryo for your pregnancy, so it would be unusual to have issues or complications. So I hope this has given us a little chance to communicate some information about this subject of gestational surrogacy for you. And Suzanne, anything else you'd like to?
If there's anything you need from us, we're here for you guys and guide you guys for beginning all the way till the end of your journey.
Thank you, Suzanne. If there are any questions, we're very happy to entertain those at this time. And I guess this is our team as well as Suzanne and myself. We have other doctors here, and Miriam is a nurse practitioner specialist. So Dr. Danzer, Dr. Alexander, Dr. Maxwell are all happy to help you whenever you'd like. I think what we'd like to do at this time is just open up the discussion to see if anybody has any questions, and we're happy to answer any. Do you want to check to see?
Wouldn't legal clearance need to be completed before you start the medical screening? No. So medical screening, we have to make sure that the surrogate is ready to go ahead and start medications beforehand. We make sure that all the medical stuff is done before legal clearance. Legal clearance is in place so that we know once the surrogate is pregnant, once she starts her injectable medications, she'll be able to agree upon whatever the intended parents put into the legal contract.
Suzanne, you want to give a shot at the cost?
Sure.
Because it's different, I guess.
Yeah, so what is the typical cost associated with having a surrogate? So it all depends. For the agency fee, I can't speak on all the agencies. All the agencies have different surrogacy agency fees. With our fees, we can definitely give you our fee schedules once you come in and ask the questions and speak with one of our doctors. For first-time surrogates, usually in California, starts between $65,000 for compensation. It can go up to $75,000 and up, depending on if they've been a proven surrogate or not.
The question, can we use frozen embryos from other places, such as Dubai, and perform the surrogacy here? Yes, you can. We actually work with a clinic in Dubai that we're happy with in regard to cooperating with them, and your embryos can come from many different places, that being one of them.
She's
question.
interested, yeah, becoming a surrogate, is there a history of abnormal pap smears, will that disqualify me?
Not necessarily, because it's common to have abnormal pap smears. As long as it's been diagnosed and treated, it should be fine.
I heard that we would need to pay for things for the surrogate, like their food while pregnant. Is that true? That's not true. Again, in the legal contracts, it'll state if you're able to, or if there's something, diet restrictions that your surrogate that you'd like for your surrogate to be on. That is something that that you would have to pay for during the pregnancy for the surrogate.
So I think that we're happy to entertain any questions in the future in person or by remote contact with the clinic here, with Suzanne or any of the physicians. So I want you all to have a good day, and it's been a pleasure to
Thank
speak
you.
with you. Take care.